and we eliminate some tax incentives.
Mr. Bevin, your response.
I will say this, we've been kicking this can down the road for 25 years. Everybody in here knows it. Everybody who's a retiree knows it. It was kicked down the can, most particularly during the previous administration, where another guy named Beshear not only never fully funded the pension, but some years didn't even put in half of the actuarially required contribution. I am the only governor in the history of this state to fully fund it, and the only way to save the system is to structurally change it for future employees and to make sure that the state, by law, requires future governors and legislatures to fund it, not making it optional as it was for the last 25 years.
A quick response from Mr. Beshear.
Well, not only did this governor try to illegally cut the retirements of our teachers, police officers, social workers, and firefighters, he stuck it in a sewer bill. That tells you what he thinks about us and that we need much better out of our governor's office.
Let me say one real thing in response to that. Number one, legislators are the ones who pass bills. They decide what gets stuck in what. Your complete incompetence as it relates to understanding the legislative process is a little bit concerning for a guy who wants to be the governor.
Audience, please. We can move on to the next question.
Okay. This next question comes from a student here at the University of Kentucky. Since the start of the recession in 2008, overall state funding for higher education in Kentucky has declined by more than a third, leading to increases in tuition. The cost of higher education has become prohibitive for many young students. What will you do to assure a well-educated workforce and citizenry for Kentucky? And Mr. Bevin, we'll begin with you.
Every single thing that we want, whether it's higher education, whether it's roads, whether it's textbooks in our classrooms, whether it's equipment for law enforcement, whatever it is that we want government to do comes out of your pocket. Every single dollar we want government to put into higher education is money that those of you in this audience and those of you that are watching this pay out of your tax dollars. At the end of the day, we only can spend what we have. The question is, what can we do to ensure that we get people ready for the workforce, which was what was implied in this? We need to make sure that we prepare people for jobs that actually exist. Let's focus our energies. Let's do what I have done in the last 3 years while I've been governor, is move to outcomes-based funding so that we get a better bang for the buck for the dollars that we do invest. Everyone, myself included, would love to have more dollars to put into things, but every dollar we put into higher education is a dollar that's going to come from what? K through 12, roads, bridges. The bottom line is we have a finite amount of it. It's incumbent upon us to be good stewards of it, to make sure that we train young people for jobs that truly exist.
Thank you, Mr. Beshear.
I believe in higher education, and it is a key to achieving the American dream. I got to see that firsthand. My dad was a poor preacher's kid in Western Kentucky. His dad was able to put him through the University of Kentucky right here. He went on and paid his way through law school and ultimately became the governor of the Commonwealth of Kentucky, and that ought to be possible for every Kentucky child. I don't just believe in higher education, I'm willing to fight for it. You know, 90 days into my term as AG, this governor illegally cut the budgets of all of our universities and community colleges. But I stood up to him. We won. We returned $18 million where it belonged, and we showed this governor we would not be bullied. Not by him, not by anybody else.
Okay.
Let me just say this. If you have to brag about how poor your father and grandfather were, that's a bit of a stretch. But let me say this. In all seriousness, let me tell you something.
Let me ask you,
Audience, please.
It's going to be a long night if we want to do that. I'm just going to say this. It is critical that we do not make promises that we do not have the money to back up. And it's easy to sit here and blow smoke, but we have to be able to pay for the things that we want the taxpayers to cover.
Follow up.
He's right. If you go back a couple generations, my family does not come from money, and I'm fighting for people who don't come from money. Everybody should have a real chance.
We do want to ask the audience once again to please refrain from applauding or from making any other sounds, because we're trying to get to as many questions as possible, important to all of you.
All right, let's move to the next question. And this, by the way, came from a student at the University of Kentucky. In the past few years, colleges have seen a decline in the number of students applying to become teachers. Many school districts now report they're having difficulty in finding qualified teachers to fill positions. What would you do to encourage and support more students to pursue careers in education? Mr. Beshear.
I believe in public education, and I'm a product of Fayette County's public schools right here in Lexington. Would not be where I am today but for my teachers, and would not be the person that I am. but for my teachers. I believe in public education so much, I selected Jacqueline Coleman, a teacher, as my running mate. She's gonna be the first active educator since Martha Lane Collins to serve as lieutenant governor, and it's about time. What we are gonna do is end the bullying against our teachers we have seen the last 4 years. Then we're gonna provide a $2,000 across-the-board raise that nobody's given our teachers. They have more than earned it. We're gonna address this teacher shortage where we have year-round subs teaching our kids in areas that are so critical to building into the next year and the next year. And we are gonna have an education-first budget where we always take care of public education first, where we shrink our class sizes, provide technology to our kids that need it, and ensure our educators have the tools where they're not doing more with less every year, they're just doing more.
Mr. Bevin, your response.
You love education, public education, so much that your kids go to private school. Is that right?
You're attacking my kids now?
No, I'm not. I'm just saying you're a fraud. And last year, when people decided to call in sick and close down schools, many with less than 24 hours notice, and many children were left unattended, and unless they had parents that could stay home with them, as my 4 children who were in public school, while your children were in private school, were affected by this. My point is this: we do need to take public education seriously, we truly do, and we need to fund it. But I'll tell you what, you're promising pay raises, you're promising increased funding. This is called Andy Candy, and you're gonna hear a lot of it over the next hour, I can promise you.
Your response, quick.
Well, I'm not surprised that Governor Bevin's attacking my kids because he's been attacking the kids all over Kentucky for the last 4 years.
You're a fraud.
He's attacked our teachers, called them names, called them selfish and thugs. They are wonderful, and they are doing amazing work. My kids got an opportunity everyone should have to go to preschool, and we fell in love with that school, so they're continuing, but just next week, my son is taking the test to go to a public middle school, and we are proud of it. I support my kids, and I'd never attack yours.
Okay, let's move on to our next question, please, candidates.
Audience, please, you're taking time. Let's move ahead.
Many Kentuckians pay more than $6,000 a year for infant child care. That is more than half the average cost of college tuition. In addition, 50% of Kentuckians live in areas where child care is not available. What will you do to make quality child care and preschool more accessible and affordable? Mr. Bevin, we'll begin with you.
Again, 100% of what we need in this state, 100% of what we want, we have to pay for. So every dollar that we put into providing more money for pre-K child care and pre-K schooling is dollars that are not going to come from something else. Do we want to take it from our highways? Do we want to take it from our K through 12, from post-secondary? Do we want to take it from law enforcement? The question is, what are we going to do to provide more? The only solution to everything that we want is to have more people living in Kentucky working, which we have record levels of now like never before, and paying taxes. There is no other solution. There's no amount of gambling or pot smoking or promises or Andy Candy that can be given to you all that's going to cover this. The bottom line is we need more taxpayers, more people here working, and we have record low unemployment, record levels of people working, record revenue right now, and we've already cut taxes 17% in the last 4 years while doing the things that I just mentioned. That is the only solution going forward.
Mr. Beshear.
I'm running for governor for all of our Kentucky families, Democrats, Republicans, independents, Eastern, Western, Northern, and Central Kentucky. But when we say we're going to be an administration and fight for all families, we got to mean it. And we've got to fight for the lost, the lonely, and the left behind. And our children that do not have an opportunity to go to preschool are left behind. When they show up to kindergarten not having that extra time and ability to compete with other kids, so often they don't catch up. We have to start moving towards universal pre-K where everyone has true opportunity, and I'm going to move us in that direction.
We'll move on. The next question is this. Kentucky has only one remaining abortion clinic, and tough restrictions have been passed by the state legislature. What is the state's role when it comes to abortion? We begin with Mr. Beshear.
Well, I support Roe versus Wade, but I also support the reasonable restrictions it allows, especially on late-term procedures. But this governor is an extremist. He supports a total ban even for victims of rape and incest, something the president doesn't support, nor does his attorney general candidate support. I work every day as attorney general with victims of human trafficking, those that have been harmed and violated multiple times a day for years before we rescue them. I believe that those people deserve options. This governor would leave them none.
Mr. Bevin.
You know who else needs an option? Those people who can't speak for themselves. The role of government is to protect the weak against the strong, the minority against the majority, the voiceless against those that have the bully pulpit. And it is the responsibility of government to defend the defenseless, and that includes the unborn. I'm unapologetically pro-life, unapologetically supportive of the unborn. I will not take money, nor am I supported by Planned Parenthood, as is the pro-abortion opponent that I face. He also is supported by NARAL, people who demand abortion right up until the time of birth. And I think it is critical that you understand in this race you have a governor that will stand for life or a candidate for governor that stands for abortion. It's as simple as that.
Well, let's be clear. This governor supports a total ban even for victims of rape and incest. Folks, I know a human trafficking survivor that was kept in a box that was burned and was trafficked to multiple people every day. I know a woman who, as a young child, was raped by her grandfather. People deserve options when they've been through this trauma. The total ban that Governor Bevin supports would leave them without those options.
This is critical enough, it's worth a response. Let me say this. There is not one of us, not one person on planet Earth, neither of the two of us nor anyone here, who has the right to decide when an innocent person should die based on some circumstance beyond that individual's control. Nobody.
Okay, once again, we want to ask the audience, please, to not, excuse me, we have a lot of questions to get to and we have a short time. So whenever we have to stop for applause or other sounds, we're wasting time. One way, and this is another question from a student, one way in which you both differ is on the issue of the Medicaid expansion. Describe who you think will benefit most from your plan and how will it impact those of us who plan to be the future healthcare providers. And again, this is from a UK student, and Mr. Bevin will begin with you.
I'm not sure quite what the question is. I will say this, though. I am a strong proponent of able-bodied, working-aged men and women who do not have dependents and have the capability of going to work go to work in exchange for that which is provided for them by people who do go to work. I'm the only one on this stage that grew up without any health care. I grew up well below the poverty level. The first time in my life I ever had access to health care coverage of any kind. I was in my 20s. I was an active duty Army officer serving this nation in uniform. I don't just speak about it with sympathy. I'm empathetic to the fact because I understand it. I've lived there. It was how I spent the first half of my life. I also know that it is an amazing degree of bigotry that allows people to assume that someone like myself had no opportunity, needed to be babied, needed to be put in a position where I was given things, as opposed to opportunity and an expectation that I seize that. My thoughts as it relates to expanded Medicaid, the question is to ensure that Medicaid is available for those who need it, and the medically frail and women with children and those that are disabled do not lose out because people like me are taking something that was never intended for them. Mr.
Beshear.
I believe health care is a basic human right, and that everybody should be able to take their parents or their kids to see a doctor when they're sick. I believe that health care is important because of the woman I met at the Dairy Queen leaving Harlan a couple years ago. She previously managed the McDonald's where she could get health insurance, but when that closed, she couldn't pick up enough shifts. She's working every single day out of choice, and she's on expanded Medicaid. Governor Bevin's plan will rip 95,000 people off health care that have it for the very first time, and I think that's wrong. And his plan is going to cost $272 million of our taxpayer dollars. That's twice as much as 4 other states that are trying this put together. And where they did this in Arkansas, the vast majority of people who lost their coverage were already working. This is red tape. This is paperwork, and it is intended to tear health care away from people. I will always stand up against that, and I'm going to rescind that Medicaid waiver in my first week of office.
Let me see.
Mr. Bevin.
Number one, you're going to rescind something that hasn't even been granted yet. Again, you have no clue what you're even talking about. This is tied up in federal court. But here's what's important to understand. You made several comments about things being ripped away from people. This isn't about people having anything ripped away from them. What I've proposed is that people work and or volunteer and or go to school or be in training or take care of someone in exchange. And this is, for the woman you just described, mission accomplished. She's already meeting the requirement. It wouldn't affect her one bit. And as it relates to the $272 million, again, neither you or the people who wrote your comments bothered to read the report. It doesn't cost $272 million.
Mr. Beshear.
Let me make something clear.
Yeah,
It costs
absolutely
up to that,
critical.
it has cost
That's your time,
$100
Mr.
million.
Bevin. Mr. Beshear.
Healthcare is absolutely critical. It's about a woman that we used to go to church with, my wife and I, that came on Christmas Eve this last year. She had had multiple pre-existing conditions, and she had not been able to secure coverage for so long. After federal health care reform and the expansion of Medicaid, she was able to get coverage. And on Christmas Eve, which was her last night on earth, she came to church because that's where she wanted to be, and stopped and talked to me about she had 4 extra years to spend with her family and people around her that she would not have otherwise had. That's worth fighting for.
Well, it comes as no surprise to us that there are sparks on the questions of health care, because we got a lot of questions as we were putting this together from the people across the state and from students as well. So our next question is a student question, and is along those lines as well. As students at the University of Kentucky, we have seen and have studied about unequal access to health care, particularly for people who live in poverty. What plans do you have to reduce this inequality in access to care? Mr. Beshear, your first responder.
Well, because I believe that health care is that basic human right, federal health care reform and the expansion of Medicaid was absolutely critical. We had 400,000 people that got health care for the first time in a state of just 4.5 million people. And here's what most people don't know. The last 10,000 kids finally got signed up for coverage for K-CHIP because we got their families signed up for some form of coverage. With the current lawsuit that threatens the very future of expanded Medicaid, rural health care is on the line. The 2 pillars of our rural communities, our public schools and our rural hospitals, are under attack by this governor. I'm going to rescind that Medicaid waiver, which is going to keep our rural hospitals open, to make sure that you don't have to drive 2 hours or 2.5 hours just to see a doctor. Everybody should be able to get the health care coverage they need in their hometowns, and that rural hospital is really important to areas like my dad's from in Western Kentucky and Hopkins County.
Mr. Bevin, your response.
Again, I'm the only one on the stage who has actually lived this life. I understand this life. I know what it's like to not have health care. I know what it's like to set broken bones and patch up things that should be stitched. This is the world that I come from. I know that it is a form of bigotry to assume that such people cannot do for themselves. It's easy to say that health care is a right, but the reality is it's one that costs money and that someone then is forced to pay for. You cannot force a person to be a doctor. The whole point of having health coverage and access is to produce a better health outcome, not simply, and it's important to make sure we truly have a minute. It is important to make sure that we get better health outcomes, and not simply the fact that you have coverage. And this commentary about pre-existing conditions, nothing that I have ever proposed would in any way, shape, or form cost anybody this. I am the only one on this stage that has ever not had health care because of a pre-existing condition. Me and my entire family for 1.5 years, just 8 years ago, had no health care because of a pre-existing condition. I understand this situation.
Quick response, Mr. Beshear.
Governor Bevin just the other day said we should go back to how pre-existing conditions were treated before federal health reform.
Never said that.
They did not, they weren't
Never
able to
said
even
that.
get coverage. He supports what are called AHPs, where you could go to the doctor, learn you have a chronic disease, but it's not covered. They could give you a prescription for it so that you could maintain your lifestyle, but you'll find out that prescriptions aren't covered. Your kids may get the flu on the way home in the car, but pediatrics isn't covered. You might get home and find out that you're expecting a child, but maternity is not covered. This governor supports health care that doesn't cover anybody's basic needs.
These are scare tactics and lies. Nothing I have ever proposed offers any of these things that he's saying. You currently are not denied, nor is anything I've ever proposed, nor do AHPs by law, as proposed by the Department of Labor. They do not allow by law the ability for pre-existing conditions to be applied to people. So everything that you're threatening is not true. And the things that you're saying I said are not true. You're lying.
AHPs don't have to cover
Stop lying,
pediatrics, maternity. They don't have to cover chronic disease management.
Okay, candidates.
They don't have to cover anything you actually need healthcare coverage for.
We're going to follow the rules here and move on to our next question.
But a good discussion on healthcare.
Yes, absolutely. Kentucky is the Kentucky is the only state in the nation whose services for persons with serious mental illness have consistently received a grade of F on report cards issued by the National Alliance on Mental Illness. So as governor, how would you raise those grades to at least a passing mark? Mr. Bevin?
The same way that we've been doing it on other fronts. When I came into office, we were getting D's and F's in just about everything. From our infrastructure to our healthcare, to our education, to the way in which we address behavioral health. We could do a whole lot better. We know that. It's nobody's fault individually, but collectively, we have a responsibility. When I was elected, we spent less than 1% of all Medicaid dollars on behavioral health. One of the things that we've done very intentionally through our cabinet is make sure that we look at what is the root cause of people that are incarcerated, people that are addicted, and what we see increasingly in homelessness as well is that the root cause of these things is in fact behavioral health issues, mental health issues. We as a nation have a big problem here as we have turned increasing numbers of people out onto the street and we don't have programs. It is important for us to recognize that we need to address the root cause of people in terms of their homelessness and addiction and their incarceration for violating the law. And where there is a need for behavioral health, we need to spend a fraction of what we're spending to incarcerate people to intercede early on and help people with this issue. It's something we've been doing like never before in the history of Kentucky for the last 4 years.
Mr. Beshear.
As Attorney General, I've been fighting for the future of healthcare reform. That includes not only fighting to ensure there's coverage for pre-existing conditions, but also fighting for the reform that makes people treat mental health as physical health and to truly cover mental health. That is at risk. It's at risk based by the battle by our federal government and this governor, but we're gonna win that battle. And I support passing a state law that makes sure that we always treat mental health the same way that we do physical health. We have plans out on andybeshear.com that address mental health where it is needed the most, and that's our schools. Our kids are coming to school with more trauma than we have ever seen. It's based not only on this drug epidemic, but other things that are going on at home because of this drug epidemic. And it makes learning for those children so difficult. Our plan works to create a nurse in each and every school, and it provides telehealth help for our veterans that are out there that so often are in crisis situations and may not make it to a VA in time to get the help that they need. Go to andybeshear.com. You'll see our plans.
Thank you, Mr. Beshear.
I'll simply say this, all these things cost money. We agree, this I'll say we probably are in as much agreement on as anything. We are not spending enough money here. We do need to spend more money here. It does affect our schools, it affects our prisons, it affects law enforcement and our social workers that interact with people on the streets and in their homes. But at the end of the day, where is the money gonna come from and what do we have to give up in exchange for these dollars? We are spending more than we ever have before, but it is coming at the expense of other things. This is called financial reality.
Quick follow-up, Mr. Beshear.
Budgets are about priorities, and you fund what matters to you the most. Public education and our children matter to me the most. We are gonna fund nurses in those schools. We're gonna fund the raises that our teachers so desperately deserve. We're gonna invest in our children first because it's the very best investment we can make.
Thank you. This next question has been debated among Kentuckians from border to border, and now it has come to this stage. Do you support legalizing marijuana, medical or recreational?
I support legalizing medicinal marijuana, and I did not get here lightly. You know, I'm the Attorney General of the Commonwealth of Kentucky. I'm its top law enforcement official. But in my lawsuits against opioid manufacturers, and I've sued more of them than any other Attorney General in this country, I believe we're gonna prove that opioids don't work for long-term pain. So what are we doing? We are filling up people's medicine cabinets with highly addictive substances that don't ultimately help them with chronic pain, but they do cause addiction. in their family members, and in their friends. I believe it is time to legalize medicinal marijuana, but we've got to do it responsibly. And having served as your Attorney General these last 4 years, I believe I'm the person that can do it.
Mr. Bevin, your response.
4 years ago on this stage, I said the very same thing, and I was the only one on the stage saying it, and I've continued to say it. I'm a strong proponent of us legalizing medical marijuana. I think it should be a tool in the toolkit that doctors have. It should be prescribed, and it should be regulated like every other drug. Where we disagree is I don't think it should be taxed as a way to make money for the state. It should be no more tax than any other drug. That's cruel and inhumane. I lost a 14-year-old nephew here in Kentucky to cancer, and his last months were horrific. And the things that he had to take to alleviate some of his pain were killing him nearly as fast as the cancer itself. This isn't something I come at lightly either. I will say this with respect to the commentary about suing opioid makers. There has been one case you've ever been involved in your life that involved a settlement with an opioid producer, and you were the one. You and your law firm defended Purdue Pharma against Kentucky, and every other law firm that you've ever sued, every other pharma maker you've sued, you've gotten zero in 4 years. Zero for the people of Kentucky. Zero.
Mr. Beshear, quick response.
Yeah, I wasn't involved in the Purdue Pharma settlement. Wasn't even at the law firm at that time, and didn't participate in any way on the AG side. But let me tell you this.
True.
This is an attempt to distract you from the fact that Matt Bevin is for the opioid companies. He went to the AARP and said Big Pharma gets a bad rap. He called these types of lawsuits shakedowns in 2015, and tomorrow he's going to be at a fundraiser in Washington, D.C. with the lobbyist for one of the largest opioid distributors in the country. They're called McKesson. That's somebody who's in bed with those companies.
I will say this, these are such absolute remarkable lies. And the fact that I do not stand up to this, while you have brought in zero to the people of Kentucky, and you've brought a whole lot of smoke and a whole lot of noise, you were a partner at the law firm that represented Purdue Pharma against Kentucky, and for you to say otherwise is a lie. It is true. You profited from it, and you refuse to say otherwise on the record or off the record. And it is important to understand that while you have brought in zero, I've brought in more than $100 million. I've put more to fight this crisis than every governor in this state before me combined.
All right, time. We're going to move on.
Coal companies are required by state law to post bonds to cover the cost for employees if they go out of business. But there is no mechanism in place to assure all companies comply. So what will you do as governor to protect miners like those at Black Jewel? Mr. Bevin?
I think it's important to make sure we close these loopholes. The reality is, you're right. There is nothing that requires it. It is supposed to happen. When they open business here, they're supposed to post a bond. There is no mechanism to enforce this or know whether or not they have even done so. When was that law passed? You'll hear all sorts of things in just a moment. I can't wait to hear it. It was passed in 2010 when your father was the governor and signed that into law that created this loophole. I don't think he did it on purpose. I don't think anybody did it on purpose. But what we learned because of Black Jewel is the fact that it exists. And I have been leading the charge on the fact, and indeed been working with legislators to ensure that in this next session, we close that loophole so that there will be a mechanism, so that there will be accountability, and so that this kind of thing will not happen again in the future.
Mr. Beshear.
I believe that a governor should always put our families above the out-of-state CEOs. And this governor entirely failed to protect those Black Jewel miners. We had over 200 miners for over a month standing on railroad tracks because they had worked for more than 3 weeks of hard, dangerous work that they weren't paid for. But there was a state law that was supposed to protect them, a bond that would have paid them for every single minute of their work. And let me tell you, there's no loophole. It assigns to the labor cabinet the duty to enforce it. And what does that mean? You're supposed to go out and do it. When they said that there was no way to know which companies were out there and which ones owed a bond, my office found out in less than 48 hours simply through some internet searches and an open records request. But this governor originally denied even knowing the law existed, and that was a lie. Because the year before, they had tried to repeal this law, side with the out-of-state CEO, and not protect our miners. This was an intentional refusal to protect our families, and it's a reason that Matt Bevin cannot be reelected.
I will say this. Here's the thing. I'm the only one that, you go down there to Harlan County. You ask the judge executive in Harlan County. You ask the magistrates in Harlan County. You ask those coal miners that stood on that track for all these weeks. Who went down there and spent time with them? Who do they believe in? Who will they vote for? You're going to find out very quickly who that is, because I'm the only one that has fought for them. They're going to get what was given to them. But this law that you talked about, your father didn't apply it because it was passed under his law. There was no mechanism. There will be now, which is why we're fighting to fix it. They will get everything they had coming to them. It should not have happened in the way that it did. And I will say this, you keep attacking out-of-state CEOs. Who do you think is going to come in and provide the resources that we need? Nucor, UPS, Toyota,
Mr. Bevin,
Ford,
we're going to move on.
GM, every
Mr.
one of
Beshear,
them. They have out-of-state CEOs.
Mr. Bevin, Mr. Beshear, give him moments to respond.
I met with those Black Jewel miners, but I didn't do it for the cameras. I met with them in a closed-door meeting. We talked to them.
Please,
We talked to them